I'm going to be covering a bit about administrative data research, data linkage in general, and the journey to a new secure infrastructure for storing data long term. And then Celia is going to take you through the looked after children data as an example of a specific data set that we've acquired. So can I have the next slide, please? There's a bit of a delay. Yep, there we go. So this is what we're going to cover. First, what ADR Scotland is and what it aims to do. A little bit about data linkage in general. The strategic impact programs that have been developed under the ADR program. Then the specific steps involved along the journey to develop the specific shape that the infrastructure has taken today. A little bit about Research Data Scotland and what future work could look like. And then Celia will take you through the looked after children dataset. Next slide, please. So ADR Scotland is a partnership between Scottish Government and SCADR. That's the Scottish Centre for Administrative Data Research. Other key partners include NRS, EPCC, and PHS, specifically the IDRIS team within PHS. We're part of ADR UK. There's also ADR Northern Ireland and ADR Wales, all funded by ESRC. So the idea is to make better use of public sector data by securely storing data for research long term and allowing researchers to use de-identified linkable data. Data linkage has been occurring for a long time in Scotland, but it is difficult. Some things about the difficulties are possibly unique to Scotland, to the types of data, and some are features of just data linkage in general. ADR aims to tackle some of these difficulties by holding linkage-ready data securely within a new infrastructure to make linkage more efficient and reduce the administrative burden on data controllers of provisioning data for research. Next slide, please. So this slide gives some examples of successful data linkage projects so far in Scotland. Linking admin data has been carried out successfully in Scotland for many years, and it has many beneficial outcomes. So these are just some prominent examples of that. So for example, the Scottish Out-of-Hospital Cardiac Arrest, or OHCA, data linkage project linked 8 complex datasets, allowing researchers to discover more information about the demographics of people having an OHCA, the number of bystander CPRs attempted, and ultimately whether patients survived beyond 30 days. This means progress towards the OHCA strategy's aims can now be measured and areas for improvement can be identified. People assessed as homeless are likely to be among the most deprived in Scotland, as people from more deprived areas are known to have poorer health outcomes, and there are many homelessness applications per year. It's important to understand the impact of homelessness, the impact that homelessness and health have on each other. The Health and Homelessness Study linked homelessness and health datasets for the first time at a national level to explore the relationship between homelessness and health in Scotland, with a particular focus on mental health, drug and alcohol-related health conditions. So the project provided a wealth of information on homelessness and the interactions with health services over time, as well as the relationship with area-based deprivation, deaths, and overlap of drugs, alcohol, and mental health issues. The Permanently Progressing study is the first study in Scotland to investigate decision-making, permanence, progress, outcomes, and belonging for children who became looked after when they were aged 5 or under. If you want more information about other successful data linkage studies in Scotland or the UK, the data acquisition team in Scottish Government can provide more information. Next slide, please. So in order to ensure that the ADR programme delivers the maximum benefit in terms of policy impacts, these strategic impact programmes, or SIPs, have been developed. The focus of each SIP has been guided by areas of key policy interest, ADR Scotland aims to obtain data relevant to the most pertinent research questions in each of these areas. So data on looked after children, for example, which is the specific one we'll explore later on, comes under the Understanding Children's Lives and Outcomes SIP. But as you can see, there's several disparate areas of policy interest which ADR aims to support research into by acquiring data to host in the new infrastructure on each of these different areas. Next slide, please. So this slide outlines some barriers to data linkage currently. Personal data has to be held in secure conditions, of course. We can't just let anyone access it. Often the data is kept on multiple systems for multiple purposes and used by people in different ways. And often no one party's responsibility is research. Administrative data research and data linkage projects require many months to years of preparation before the data can be accessed, making this an underutilized approach. Data controllers sharing data for research also do so on top of their normal jobs, and because they don't do it often, it can take longer. Data collected for other purposes suits its day-to-day purpose, the reason it was actually collected, but it's not always understood how well the variables can be used for research purposes. Also, importantly, up until now, datasets have been created and linked for a specific project or set of questions. Then, once the project is completed, the datasets would be destroyed and are therefore not available for further research projects. So ADR Scotland builds on the existing data linkage work to create a secure infrastructure for storage and linkage of data. Next slide, please. So this is a diagram of how data linkage is currently performed now, as in pre-ADR. Infrastructure based in the national safe haven is shown with the dotted lines there. So for example, if we wanted to study prescriptions for medications relating to stress for a cohort of pupils who didn't have exams this year, the two data controllers, which you can see those two gray circles on the left, they can't just share all the information with each other, as each of the controllers don't have the right to know the information of the other. Also, the matching isn't done directly between the two datasets. We would match to a population spine at NRS as a more reliable source. So the process would be education would send the identifiers of the cohort of people who didn't have exams this year to NRS, who would then index those people to the spine. They would then send back linkage IDs or index numbers, as they're sometimes known. Data controllers would remove any personal identifiers from the data, add in the linkage IDs, and send all of that information into the safe haven in the linkage area there. That same process would be repeated for the other data controller, but with different linkage IDs. NRS would then send a master indexing key to the linkage agent in the safe haven, which is basically a lookup table showing how the IDs in the two datasets match to each other. EPCC then runs some simple software to replace the linking IDs with the master, therefore linking the correct data for each person between the two datasets. And then they would make the linked dataset available to the approved researchers in the researcher area there. So no single organization has all of the information about a complete dataset or an individual, which is a separation of functions, which makes the system very secure. But sadly, all the data, all the linked data is then deleted, and the whole process would need to be redone again for another cohort, no matter how similar a future research project might be. An ideal solution to this would be for the data controllers to deposit data sets they are willing to share in their entirety one time only. Then when a research project is approved, EPCC could extract relevant cohorts from several stored data sets and whatever variables happen to be required by the research project, link them all together and make them available. But there's reasons that we can't do it that way, which I'll get to in another slide momentarily. Next slide, please. So this is a representation of the ideal solution I just described. Data controllers would deposit the whole data set once. An EPCC could extract relevant cohorts from several data sets, link them all together and make them available. Unlike the diagram on the last slide, this process would only need to be done one time for each data set, not every single time a project is approved. But things don't work that way, as we'll see. Next slide, please. So this is a brief summary of why the solution on the last slide has not been implemented. So the public is unhappy with a big public sector data warehouse. That is based on public engagement with the Scottish public that was done back in 2012. So it is possible it may have changed by now. Potential solution is to hold many data sets, but those accessing them at rest can't link them, meaning there's no single linkage key between data sets. So only approved research projects will be able to link variables from different data sets to any other data set. There's also the principle of data minimization versus data use. So we need enough data for cohort creation, but not so much that data becomes identifiable. Potential solution is to include the required variables for cohort selection within the holding area, but not necessarily make them available for research. So that would be having different access rules for different variables, even potentially within the same data set. Another potential solution is to separate identifying demographic information from storage data. We could do this by giving them different IDs so that they can't be linked without some input from NRS. And that's basically what we've done. So as a result of this, we need to have record and person level IDs on a data set. Person level to be able to say that this person is that person across data sets, and record level so that we can link demographic data at the right time for people. So if somebody moves, we can say this person is that person. We know it's the same person, but they're in a different place now. Data storage forms is also an issue. There are often several tables with no demographic data held by data controllers. So, for example, you might have a table with information all about a school student with a field that something like a date they were excluded from school. Then another table with information about the exclusion, but no demographic information. That poses a problem for cohort creation. It's impossible to select everyone under a certain age, for example. If we have no variables on that particular table that could indicate age. To solve that particular problem, we can have just one demographic table per data set. Each record will have a demographic linkage ID to allow this information to be matched to an individual at record level in case they move, for example. And then supplementary tables with no demographic info would have just a storage ID to allow linkage to that person and their respective demographic information. So that's just one example of an issue caused by data storage forms, and there may be other manipulations that need to take place in order to make storage of the data in a linkage ready and secure format practical. This process wound up being so complicated in some instances that to prepare the data, well, we had to agree that our team within Scottish Government would access and prepare the data where possible. Luckily, in the short term, most data sets come from within Scottish Government, so we're able to do this as we write documentation for external data controllers. The methods needed to prepare data sets will vary widely depending on the format and the content of the tables, but essentially what we need to do is separate the data into tables which allow us to comply with data minimization principles while allowing for the data to be brought back together, potentially also with variables from other data sets as well for approved research projects. Next slide, please. So this is what we've ended up with. In the end. The design was built on engagement with the public, data controllers, and those working within the system, and had to balance the challenges I mentioned before about data being personal and therefore controlled, while still needing to have enough data in the system to create cohorts. So the green arrows on this diagram indicate data being ingested into the system where it will stay long term. When a research project requires data to be linked and accessed, it follows the blue arrows, and these are two separate processes. The dotted line represents systems within EPCC, and the three areas within EPCC separated by these lines are separated this way for the security of the data. So I'm now just going to talk a little bit about how this architecture is designed to keep the data secure. The data is separated into three parts, all of which are held separately. So we have to ask data controllers to break things into identifying information for indexing against the NRS population spine, demographic variables such as geographical information, gender, or age, and the storage data, which is essentially all the other variables. There'll be storage and demographic keys at record level attached respectively to each of these datasets, with both keys present on the indexing file to enable NRS to create master linkage files for projects. NRS only receive enough information to match individuals to the population spine. The information EPCC receives has no personal identifiers, only the keys, which cannot be linked without input from NRS. There's a number of extra security measures which have been brought in to reassure data controllers. So for example, storage data from multiple data sets are all kept together in the storage area, but they don't have a single linkage identifier on them. So EPCC staff within the storage area can't link the data sets without input from NRS. The IDs within the storage and demographic areas, even for the same data set, are also different. So even if an intruder breaks down all the firewalls, which is very unlikely, they could still not link the those variables together without further information from NRS. There are also access controls, so different EPCC staff can only access one of these areas. Once it's ingested, data is held in this way until projects require them. This will reduce the administrative burden on data controllers who previously would have to prepare and supply the data for each approved research project requesting it. So even though the linked data will still be destroyed at the end of the process, after the researcher has completed their research course, the administrative work of preparing the data will not need to be done for every project. And the process of linking the data will involve fewer parties in many cases, meaning there should be fewer opportunities for errors. So the system still takes a lot of partnership working, obviously, but it's incredibly secure and allows data to be held for reuse in a manner that reassures data controllers. So we do now have 3 data sets ingested, and Cecilia is going to tell you about the process of ingesting the looked after children data. So just to give a quick summary of how the data would be linked for a project now. For each project, EPCC and NRS would exchange information about the IDs of the cohort. EPCC sends the IDs of, for example, everyone aged under 5, if that's what the project is interested in, and the encryption methods, that would be the salts for hashing any of the variables which are sensitive. NRS creates a master indexing key and send to the linkage area. The demographic agent sends the demographic data, and the storage agent sends the storage information or to the linkage area. The linkage agent then uses the master indexing key from NRS to link the required data sets. Then after it's been checked, it gets moved into the research area for analysis. Next slide, please. So future work is going to include integrating the work of ADR Scotland with Research Data Scotland, or RDS. In the short term, this will involve using the researcher service in development by RDS to promote the datasets acquired by ADR. RDS is a new service for accessing public sector data in Scotland. Since it can be unclear what public sector data is available for use in research and data can be of unknown or poor quality, we need to work with data controllers and data users in order to improve the quality for research use, as well as ensuring that there is widespread trust from the public. RDS is looking at the broader public sector data access landscape relative to what ADR is doing, but the infrastructure we have developed under ADR will form an important part of the RDS offering. ADR Scotland is continuing to acquire data. As I mentioned, we currently have data sets ingested from education analytical services within Scottish Government, including the pupil census. And Cecilia is going to tell you about the LAC data, looked after children data, just to give you an idea of how all that works in practice. Once ingested into the infrastructure, researchers can apply to access data linked to other data sets without the data controller having to provision the unlinked data every time. RDS additionally aims to enhance the existing IDRIS service, which already assists researchers to deliver hundreds of data access and linkage projects each year. This will be done by bringing many existing entities in the data linkage landscape in Scotland under the RDS umbrella in order to simplify the data access process and permissions for linkage. And with that, I'll hand over to Cecilia, who should be able to pick up from the next slide. Are you on mute, Celia?
Yep, that's fine. Thank you. Okay, thanks, Tom. Okay, so this part of the talk will describe the developments that we've gone through to create a longitudinal data set on looked after children. So as Tom said, this work is part of the ADR Scotland funded programme. And I actually moved from having worked as a statistician in children and families analysis, collecting this data, to work in the data linkage team because it was an opportunity to acquire the resource we needed to do this development on the data set. And obviously Tom has joined the team to help promote this work. So okay, so I'll just give you a bit of background to the looked after children data set that we've been using. So administrative data is currently collected every year by Scottish Government from local authorities. And before 2009, this data was in an aggregate return. So these summary statistics were collated by the Scottish Government and published. But at that time, the data collection changed to being individual level. So individual records were provided on each child in care. And that was possible due to developments in the management information systems in the local authorities and took advantage of the increased complexity of the data that was available. So this is a summary of what is currently collected. For each child, information is provided on their characteristics, including information on equalities. And crucially, the local authority provide a unique child identifier that they use in the social work systems. And in addition to that, for children who are at school, the Scottish candidate number is provided. And currently, this is the way in which data on looked after children can be linked to other administrative data through the NRS spine. So in terms of the care history of the children in the care system, information is provided on what we call an episode of care. So that's the point at which the child is legally looked after until they subsequently leave the care system. And while that period of care is ongoing, they can have what are called placements. So a foster care would be a placement, or they could be living with relatives, which is called a kinship placement. So the kind of complex makeup of the care episode is described in the data set as well. And accompanying that information is there's a legal basis for each of the types of care that a child is having. And so that's collected in parallel with this information on the care placements. As with lots of data collections, these collections are reviewed on an annual basis with the stakeholders and the data providers, and adjustments are made occasionally to meet the user need. Some of you, if you're interested in this particular topic, will be aware that Scottish Government have just finished a consultation on the collection, and particularly prompted by the care review, which was published last year. So Scottish Government currently publish two main annual publications, one that summarises the population of looked after children, and the other one on the educational outcomes of children in care system. Oh, sorry. So once the individual annual returns were established, it was recognised that there would be great benefit in using these to create a longitudinal picture of children in care. A version of this longitudinal dataset was produced by our team in 2018 and has been used by researchers. The Permanently Progressing team used a version of that, and Gillian Rabb, who works in SCADR, which is the Scottish Centre for Administrative Research, has used these data to publish a report on infants born into care in Scotland. So, as I said, the ADR funding has allowed us to update that data set with an additional 2 years of data. And another aspect of the work has been to improve the information that will be provided to the users of the data. This is what I'm going to talk about later. But many of these improvements have come about because we collaborated with Gillian and the other researchers on their projects and gathered lots of information about issues with the data set that we've been able to take account of. And so we've built that into the process. So this slide here just describes a few benefits of creating the longitudinal data set. And the main thing is that the current collection only gathers data on children who are in care at a particular point in time. But by combining annual returns together, you can then build up a picture of care for an individual child, because they can have more than one episode of care. This allows you to look at the birth cohorts of young people and how their care changes over time. And also you can look at the different outcomes for children who are, for example, in foster care compared to kinship care. As you'll see from the next few slides, by combining data together over a number of years does, by its nature, provide lots of information about data quality, which we're able to feed back to both the producers and also the users. And also the longitudinal data set makes it easier to carry out revisions when data sets change and information's adjusted. And obviously the other thing is it greatly increases the value of the secondary data analysis. So just to describe what the longitudinal data set looks like, this is a very simple example of what we've done. So as I said, each year data is supplied for all the children who are in care during the year, from August to July is the period of collection. And the data returned from the local authorities is a complete history of the most recent episode of care for the child. In other words, from where it started care. And the example above, the example here is for a child who starts care in April 2011 in a foster placement, which is number 3. The year later, the child's still in the same foster placement, so we get the same information again. In 2012-13, the foster placement ends. in February, and another foster placement starts at the same time. The care episode ends finally on the 27th of July 2014. So we take these 4 sets of data, combine them together, and because everything's very neat and tidy, you basically get 2 records with those 2 care episodes, and highlighted in orange. As you can imagine, the situation is not nearly as neat and tidy as all this. And this is the work that Tom and I have been doing, investigating some of the data issues that this process throws up. And in particular, as I said, building in some of the information that the researchers have fed back to us. So the sort of things that we identified that happens with the data is the child level characteristics, which you wouldn't think should change, sometimes do change from year to year. So dates of birth, for example. Previously provided placement dates. So in other words, the time that the placement started and end will sometimes change between one set of data and the next. An issue that we kind of had identified a while ago that is a bit of an issue, a bit of a problem for summarising the data is sometimes a child is in care in a submission from a local authority and they're still in care on the 31st of July. But the next year when we get their data, that child has disappeared and we don't know what's happened to them. And this is not what should happen because clearly that child was in care at the end, and so you will be in care the day after. A lot of these changes and discussions with local authorities we've identified are things like changes in recording practice, updates that are made to the data when errors are identified by the social worker or the person entering the data. Sometimes these are just by their nature of reflecting the administrative process, but other times these changes have come about because the local authority has been through a fairly major data cleaning exercise. And it may have been known about 5 years ago when the data was being gathered, but that intelligence hasn't necessarily been passed on with the data sets that we've been using. So in some cases, having looked at the issues and spoken to the data providers, we've been able to make changes in the process that was being used to create the data. And I'll talk about some of these later. And in other situations, it's basically not easy for us to tell what the correct data is. And in the meantime, what we've decided to do is retain quite a lot of the records that may appear to be inconsistent, but particularly when we don't actually know which is the correct version of the data. But what we've done is flag these in the data set so the researchers or users of the data can make a judgment themselves about what particular subset of the data to use. And our next step in this project is to go back to the data providers and start to speak to them about some of these to see if we can remove some of the records, because they will be able to confirm that they're not correct. So this work is nearly finished. We've taken since March to complete this work, so it's not an insignificant project. And I think it's worth saying that with a lot of other administrative data sets, it's not likely that we're going to have quite such a big job to do. This was a particularly complicated one. But what's ended up being produced at the end is a record that covers about 60,000 children, around 70,000 episodes of care, because most children only have one episode of care, but some of them have multiple episodes. 140,000 placements, and slightly more legal reasons, because you can sometimes have more than one legal basis for a placement of care. And as I said, the data sets, in addition to the content of the data sets, we also include the data quality flags that we're going to provide along with some guidance on how to use these data. Additional data flags are going to be included in the user guide. So that's what's going to be produced and published probably in a couple of months once we've ingested the data into the system. But I'll now go on to talk a wee bit more about the process that we went through to create the data. I hopefully will have let me know, Genevieve, if you want me to speed up. But this is kind of highlights what steps we had to go through and what we learned about the data. So obviously we had to identify the kind of definitive data sets to combine with together, and we've used the data specifications that are provided to the local authority as the starting point for what's in each of the files, and that's helped us document which variables might have changed over time, which is always a possibility. The initial checks were basically things that were informed by our previous experience, and they're mostly obvious things that you would want to check, knowing the nature of the requirements of the data in the first place. So things that we identified, where the social work identifier is a unique identifier for a child. Sometimes they had more than one candidate number, which they shouldn't do. Sometimes they had more than one date of birth. And sometimes the candidate numbers had, the same candidate number had more than one social work identifier. So then the other checks that we were able to make was that things like episodes of care were left open, or there were overlapping dates, which again shouldn't happen from the way the data is collected. So this slide just gives you an idea of what we're able to do in terms of, we were sometimes able to change the processes, because when we looked at the issue, it kind of told us something about the data. The issue about multiple candidate numbers were in most cases that the first time they'd entered a candidate number, it was invalid, it had the wrong check digit, the check digit identified it was wrong, and therefore we were able to use the last one that was valid as the most likely correct one. The dates of birth being different were quite often situations where local authorities had changed their practice. Sometimes they had previously only given us month and date of birth, and then subsequently gave us details, or vice versa, in which case we came to an agreement with the local authority on what they wanted us to use. Others looked like just edits, because you could see that the digits had changed, but we're not really able to do much about that. So at the moment, we're just assuming the last one is correct. The information about, the information about multiple social work identifiers did reveal some useful information. One of them was, in some cases, there had been a wholesale change of identifiers by the local authority, which had happened in the past, and that information hadn't really been documented, and therefore we weren't aware of it at the time. However, we were able to work with the local authorities to make sure that we were able to link the children using these adjust identifiers, so it could improve the linkage. It also identified a situation which we knew could happen, but was where the same child appeared in more than one local authority, which is obviously something that can happen. And as long as we were able to confirm the same characteristics for the child, we concluded that these were the same child, and we've also identified that in the data set. However, this did highlight the situation where children were in two authorities, and they can only be in the care of one authority at once. But it seemed, according to the data that we were being provided, that they were simultaneously in two authorities. In other words, they were still on the books of the originating authority, which is obviously incorrect, and something we will discuss with the local authorities to see what their procedures are, and try to avoid that happening in the future. So the other situation in particular where we had changes with dates and data that's being provided with over the period with different dates, as I said before, we at this stage we've decided we're not able to confirm which sets of placements are correct. It's probably the case that the most recent set of data that been sent with is going to be the correct one. But until we speak to the local authorities, we've decided to basically retain information that we get provided for complete sets of episodes that are consistent, but any historic records that are out of date, we're also going to include. But as I said, we're going to flag where this has happened. So in terms of scale, just before I finish, to give you an idea of what we've discovered is, as I said, we had 60,000 children. We've got 2,500 where the same episode has been provided in 2 years, but not with exactly the same information, which means primarily that a placement date has changed in the middle of this episode, and so that some decisions got to be made about which ones to keep. But that's the scale of the problem. We've also got overlapping episode dates, which is a situation where maybe the start dates changed or the end dates changed, both of which seem slightly odd, but that's 700 cases. We've got another 700 where an episode of care is usually followed by a period where the child is, at home, not in care. So sometimes the dates are a day apart, and again, that can't be the case. Oh, sorry, I'm going to not answer my phone. Then we've got about 3,000 episodes that are not closed, which is the problem that I talked about earlier, and another 2,000 where the destination that the child has after their care, which is maybe you've gone home or you've been adopted, is missing. So that's quite a big omission, and something we're going to have to work with the authorities about. So finally, the documentation that we're going to provide with the datasets is for the looked after children. We've created a metadata spreadsheet, which is fairly simple form, but we've decided to adopt the approach that the Ministry of Justice Data First project has been using for a ADR UK funded project, to see if that will be a useful model. We'll also provide some information about distributions of the variables in the data set. And as I said before, because this data has been quite a complicated process and we've had to make quite a lot of decisions about what to do in certain circumstances, we've written that up and also described what the data quality flags are and how you might use them, and in particular where you might find differences with published data, what that might be caused by. So the final stages with the looked after children data is it's currently with the data controller, who are children and families analysis in education, for a sign off, because effectively they're going to own this product. We're just going to be using it, and it will now be passed to the EPCC team for ingest. As I said, we're going to work with local authorities, partly to find out how much they would, whether they have any resources or what they would be able to provide to us in terms of other intelligence about the data quality, and also to discuss with them how useful they would find the data that we've created for their area, because it's possibly something they would find use for in their planning and just understanding their population. We are about to do a pilot linkage project. So as I said, as Tom said, the data and education is in the infrastructure. This data will be in the infrastructure. So we're going to go through the stages of linking it together to just test the processes are working. And when that data is provided, it will be the first time a researcher is able to look at this slightly more complex version of the data, and we'll work with them to effectively see if there's any more, it might be there's too much information, and so we have to work out what the balance is between providing lots of detail and putting the onus on the researcher to decide, or making more decisions ourselves. And in the longer term, as more people use the data, we'll want to gather information from any user to improve in future developments. So finally, in summary, ADR Scotland has an expanded data linkage infrastructure, and this will be used for secure linkage in public sector data. As you'll understand, it is complicated, but reasons for doing it have been well set out, and it will be worth it. 3 data sets that are relating to education are now available. and the longitudinal looked after children dataset will be available soon. And as I said, due to the collaboration with researchers, hopefully we'll have developed this dataset with researchers' requirements in mind. Thank you very much. That's the end, and that's our contact details and various websites and Twitter accounts if anybody would like to get in touch with us. So thanks very much for your time.